And good evening and welcome to RFL. I'm Richard French. Thank you for joining us this Wednesday evening. Now, as coronavirus continues to spread here in the country, we'd like to make you, our viewers, a part of our program tonight and get to both comment and also ask questions. We're going to be joined by an ER doctor who has fielded your calls in the past, so you can ask him questions, also express your concerns. The phone lines, as we speak, are open right now. They fill fast, so please join us. The toll-free number right on your screen, 888-766-2428 or 888-RNN-CHAT. Now, before we get to the doctor and your reaction, I wanted to show you this map because I think it does an excellent job of illustrating just how much our situation has worsened in just the past month in this country. Red and orange, bad. Those colors show states that are experiencing big spikes in COVID. One map June, the other July. June 1st here, only a handful of states are showing a lot of growth in people testing positive. Today, only 1 month later, practically almost the entire country is trending in the wrong direction. Now, the U.S. has more than 2.6 million cases. We're approaching 128,000 deaths, and that could be a big undercount. Researchers at Yale have just put out a report saying the actual number of deaths could be 28% higher, which would put us above 163,000 dead Americans. Put your arms around that. And now states that reopened the quickest, like Texas, Florida, Arizona, they are leading the country in infection spikes. Other states like South Carolina, Georgia, California, not far behind. With the number of cases soaring, more than 20 states are rolling back or pausing their reopening plans. Now, just today, the governor of California announcing that bars in 19 counties will have to close, tasting rooms and wineries will also have to shutter. And in New York, Governor Cuomo, he has delayed the start of indoor restaurant dining in New York City as a precaution. Cuomo, he also had some very choice words for our president today.
He denied it all. Denied his science advisors, denied the CDC, denied Dr. Fauci, denied them all. Reality wins. And reality won. And now the country is suffering because of the president. And it's time for him to change course. When you're in a hole, stop digging. Will Rogers. It's time for the president to actually tell the truth. The first thing he can do, come clean with the American people, admit the threat of this virus. Admit you were wrong. It's not an admission. Everybody knows you were wrong.
Now, speaking of Dr. Fauci, he made this alarming prediction while testifying on Capitol Hill yesterday.
We are now having 40+ thousand new cases a day. I would not be surprised if we go up to 100,000 a day if this does not turn around, and so I am very concerned.
His concerns, though, not shared by the president. Donald Trump apparently is still in denial.
I think we're going to be very good with the coronavirus. I think that at some point that's going to sort of just disappear, I hope.
You still believe so? Disappear?
Well, I do. Yeah, sure, at some point. And I think we're going to have a vaccine very soon, too.
Now, the president is doing a 180 on masks, at least not condemning them. After spending months denying that they were even effective and poking fun, for example, at Joe Biden for covering his face, Trump has said this about masks.
I'm all for masks. I think masks are good. I would wear, if I were in a group of people and I was close.
You would wear one?
Oh, I would. Oh, I have. I mean, people have seen me wearing one.
Whatever it's worth, there's been many incidents where he's been in close proximity to others where he's been unmasked. But anyway, I want to bring in our guest, Dr. Cioe-Pena. He's an emergency room physician for Northwell Health System. He's also the system's director of global health. He's been kind enough over these last trying months to give us some of his time to answer some of your questions, and I will get to your calls coming up. But Doc, there are viewers watching us today in Texas and in California and along the eastern seaboard, especially the southern portion, that are starting to see scenes that you lived through and that you never want to go back to. Prepare folks that weren't familiar with what April looked like in New Jersey and New York, in the metropolitan area. And I know you hope they don't see the full breadth of what we got hit with, but tell them how the next few weeks are going to start to look potentially.
Yeah, I mean, especially as infection rates rise, the death rate lags behind that 10 to 14 days. You're going to start seeing hospitals get overwhelmed. You're going to start seeing ICUs fill up. You're going to start seeing hospitals frantically changing common areas, cafeterias, auditoriums into patient care areas. And you're going to start seeing where the medical resources are thinnest in the system. And for each state, it'll be different. So in some places, it's going to be ventilators. In some places, it'll be PPE for their physicians, nurses, and other support staff. In some places, it's going to be just the staff itself and having the people there at the bedside to take care of patients. But the problem with the failure of public health is that it then falls to the individual providers to try and mend the gap, and it's a gap that's not mendable at the stage at which they're addressing it. And so it is dire.
There has been this narrative that's come out to say, well, a much bigger portion of the population in Texas and in Arizona and California, well, they're younger patients, and the mortality rate hasn't corresponded with the positive cases, so it's not as bad. When you hear that, what's your reaction?
Well, I think there's two things. I think that this virus is incredibly infectious, and younger people do better than the elderly in terms of death rates, but they also spread it much more quickly, especially when not wearing a mask. And so, you may see a lag in elderly deaths, but you're certainly, with no public health measures, no efforts to contain the virus, people that are in their 30s and 40s can become the spreading mechanism by which the virus moves to the rest of the population. So I don't think you're out of the woods.
I want to get to two emotions. First, fear or concern. I've noticed sober people throughout this pandemic, there's been a whiff of fear as to where this might be going, and this complacency that they warned against that went unheeded, that we're not past this, but yet so many states reopened, as I mentioned, very quickly, and they're seeing the spikes and they're seeing the spreads. And I mean, nobody wants to undertake it, but New York City's and New York and the greater metropolitan, better equipped, more equipped to handle than where some places are going to be to see this as well. Do you share their concern that people aren't really getting their arms around just how bad this thing could get here in the next, forget about a couple months, in the next 2 to 4 weeks?
Yeah, I think there is. There's a cognitive kind of dissonance between reality and what people's expectations are about what this is. So number one, everybody's tired of this virus. We're tired of social distancing. We're tired of the economic paralysis. We're tired of it. It's been a long time. Unfortunately, the virus doesn't care. It's dispassionate. It's a very simple machinery that very efficiently infects us and can lead to bad outcomes in a good portion of people. And unfortunately, it doesn't matter what your opinion of it is. It's going to affect the population the way it has affected the population in New York, the way it will affect the population in Texas and Arizona and Florida. And unfortunately, it doesn't play politics. It doesn't play. There are very simple facts, and so I feel for the leaders nationally that have been saying how to prevent what is happening right now, have been repeating it over and over. I feel their frustration because I understand the desire to move on, but we're not ready to move on.
And that's what I was going to get next to, was the anger portion of this, because while it was unavoidable that we would have to deal with a global pandemic, we look around the world. The countries, he said, my God, I remember sitting at this table. If we're not careful, we could be Italy. We wish we were Italy now when we look at where they are on this curve versus where we are. And they, like so many other countries in Europe, took precautionary steps, and in Asia as well, that we ignored. I want to play a couple sound bites. I could play 50 of them, but I'm just picking two. This lieutenant governor in Texas and the governor in South Dakota. In the president, he will be in South Dakota, and there will be an event where masks will be optional. And social distancing will be ignored. And in Texas, well, we already talked about how bad things are going, but I wanted you to listen to what they have to say, and as a healthcare provider, just how you feel. Here we go.
Fauci said today that he's concerned about states like Texas that skipped over certain things. He doesn't know what he's talking about. We haven't skipped over anything. The only thing I'm skipping over is listening to him. I don't need his advice anymore. We'll listen to a lot of science. We'll listen to a lot of doctors, and Governor Abbott, myself, and other state leaders will make the decision. No, thank you, Dr. Fauci.
In South Dakota, we've told people to focus on personal responsibility. Every one of them has the opportunity to make a decision that they're comfortable with. So we will be having celebrations of American independence. We will have a large event at July 3rd. We won't be social distancing. We're asking them to come, be ready to celebrate, to enjoy the freedoms and the liberties that we have in this country.
Listen, I can only imagine for you. But the palpable frustration I have that somehow just a general, minimal concern to put a mask on to show some courtesy to your fellow man is an infringement on your liberties, and that Fauci's being talked down by a guy who said, you know, he's willing to sacrifice grandma and grandpa to open up, you know, a bar earlier, which is what Patrick said in Texas. So much of this was avoidable. My God, it must drive you crazy. And if anybody doubts this, if they just shadowed you for one day in April when people were lined up in the hallways and you had freezer trucks to take care of the dead and you had to have nurses be the only lifelines to loved ones because they couldn't see them in their final moments, I guarantee you they'd change their minds, wouldn't they?
Yeah, probably. And the problem is, in the true literal sense of the word, is part of this is unimaginable for people that haven't gone through it. They just can't imagine what it's like. And I think that's part of the issue. And this whole idea of individual liberty, I'm not knocking individual liberty, but the idea that we aren't all interconnected and that my decisions affect someone next to me, that my decision not to wear a mask and go to a rally will affect other people around me. And it may not just be people that have decided to go to the rally. It might be the grocery store clerk that I have to go interact with the next day. We are all interconnected. Our decisions affect other people. And our society has evolved around that concept, from drunk driving laws to seatbelt laws. All of these things are designed that we are interconnected and that our decisions don't occur in a vacuum.
And we don't have the luxury of time, literally. In the next 2 weeks, it will shape the scope for so many of these states. And we have a lot more questions. I'm going to get to your reaction. As soon as you come back from the break, I'll go right to the phone lines. You don't want to hear from me. You want to hear from Dr. Pena. I'll give you the opportunity to do that. I also have questions with what's going on in other states. Will it come back to the states that are finally on the right side of the curve? We'll get into that and much more after this.